So most men and women have made insertion of their oral cavity, that is their mouth, in any public area that comes across them without knowing their partner's health status, probably because they're competing for the Headies Award. Bear it in mind that as you compete for this award, oropharyngeal cancer might be watching every move you make, because studies have proven that type 16 human papilloma virus, that is HPV, an infection that is gotten through oral sex, might increase your chances of developing oral cancer, that is oropharyngeal cancer. Apart from HPV, oral sex poses a risk of contracting certain sexually transmitted infections or diseases such as HIV, herpes virus, chlamydia, gonorrhea, and syphilis. So here are some tips that will help you lower your risk or chances of contracting certain sexually transmitted infections through oral sex. One is use of barrier method. Always use condom or dental dam during oral sex. Second is practice of good oral hygiene. Avoid flossing or washing your mouth before and after oral sex, because this can create tiny cuts that can serve as pathway for potential pathogen that causes sexually transmitted infection or diseases to enter into your bloodstream. Third is rinse your mouth after oral sex. Rinsing your mouth after oral sex can serve as a way of removing this potential pathogen that cause sexually transmitted infection from entering into your bloodstream. That one is the most crucial and the most important tip, because this will help you to know whether to abort that mission or use a barrier method, which is always know your partner's health status. So it is advised that once you're sexually active, always get tested for certain sexually transmitted infection or diseases for at least every 6 months, most preferably every 3 months, whether you have any signs and symptoms or not, because some of these sexually transmitted infection or diseases can be asymptomatic. That is, you might be a carrier without knowing, and this can make it easy for you to transmit it to your partner or develop certain health problem that is associated with these diseases.